Well, now, many times when you hear of the U.S. Navy, you probably think of conflict, but in fact, the U.S. Navy has a medical unit that partners with African nations to offer humanitarian assistance. Vice Admiral Adam Robinson, the U.S. Navy Sergeant General, was recently in Botswana. He told me about the Navy's partnerships in Africa.
What we're doing in Africa is partnering with nations so that we can extend not only humanitarian assistance, but more importantly, we're trying to partner so that we can develop educational programs so that we can help the nations that we participate with develop their medical infrastructure so that they can carry on without us in the future.
Many times when people think about military partnering with some agency in another country, they think perhaps you're going to work more closely with the military over there. Is that the case, or are you working in fact with civilian entities?
When we talk the partnerships that we're doing within Africa, we very often will partner with the military, such as on the AIDS and the HIV programs that we have developed over the last many years. So very often those would be mill-to-mill partnerships. But we're also doing partnerships with civilian entities, with university, with educational institutions, and with non-governmental institutions.
How different is this from the partnerships that the U.S. government develops with the developing nations, for instance, in Africa, the funding that sometimes is directed to medical schools or some medical institutions or research organizations that is from the government of the U.S., but not necessarily from the Navy or the military?
Very often funding would not be from the Navy per se. It would be from governmental institutions. It would be from USAID. It would be from a variety of both intergovernmental organizations and also non-governmental organizations. The key is to help develop the infrastructure for the partnering nation so that they can carry on the goals of developing the medical, in this instance, the medical system and the medical educational system that they need for their country.
Give us a sense of how, in fact, advanced medicine is within the U.S. military, within the U.S. Navy.
Navy does a tremendous amount of basic bench research in infectious disease such as malaria, HIV/AIDS, and other areas. We also do a tremendous amount of work with surgery and with clinical specialties.
And I'm aware that in some instances, in fact, you have used kind of floating hospitals that have helped people in disaster areas, but sometimes even just provided medical assistance to some poor countries. Can you give us an idea of where you've been?
The Pacific Partnership again, in the Pacific, has included the USNS Mercy, which is one of the two hospital ships. The Africa Partnership Station has used the USNS Comfort. Both of those are hospital ships and have a complete complement of medical personnel that can do humanitarian assistance, disaster relief work.
Because of the kind of suspicion always associated with the military's presence anywhere, how do you debunk this kind of ideas and also get people to understand that the objective of the Navy is, for instance, to build capacity?
I'm going to answer in a couple of ways. Number one, we only go where we're asked to go. Number two, the vaccines that we're using, the methodologies that we're using, the medicines that we're using, the medical treatments that we're using are all evidence-based treatments. They're all vaccines and medicines that have been vetted and come through the most scrupulous processes that we know. The same medicines and vaccines and treatments that are used in the United States, and the quality of care, the humaneness of that care, and everything that we do from an ethical and a moral perspective, we will do in this country, and we will do no less in any other country. In terms of motive, my motive as a physician is to first do no harm, that we do this freely and that we do this with every good intention.
That was Vice Admiral Adam Robinson, U.S. Navy Sergeant General.